This is Jen, and I am going to be talking about arterial lines, and we're just going to go through one objective. So our one objective today will include to talk about the indications for an arterial line, where the sites of insertion are, and what kind of equipment we need to gather in order to get an arterial line set up. So our indication. So generally, oftentimes the arterial line gets placed because you need frequent labs or arterial blood gases to monitor acid-base imbalances. You would want to monitor the arterial blood pressure on a continuous basis, monitoring for signs of shock and the management of shock. Major surgeries often need to be having that arterial monitoring continuously throughout and grabbing labs throughout the case. Any types of emergencies that may come in, and then any kind of vasoactive drugs that patients may be on that you may need to go up or down on. So arterial lines could be called A lines, art lines, peripheral arterial lines. They're all acceptable. The equipment we need. So we need an arterial catheter placed by a provider. We need the pressure transducer set. We need syringes and a heparin 1:1 available in the syringe. We need our infusion pump, our VAMP Junior, which is a closed system which allows us to give back the blood to the patient and keeps it closed. A plate to hold the transducer, the actual monitor, the monitor cable with the red indicator, and then the pole, which will hold all the components together. So our sites of insertion. Generally, the radial artery is the most often used artery for arterial blood gases. The brachial artery is another place up in the antecubital area. And then the femoral artery, definitely accessible there, but it is a very large artery. So the Allen's test I'd just like to mention about for the radial artery, it's something that we want to check for collateral circulation. So we want to make sure that the hand will perfuse after compressing on the ulnar and the radial artery. So when you release one, the blood flow will go back and then they know it's safe to use. So our take-home points for today are, as we talked about, the indications, the equipment, the sites of insertion, and our resources. Obviously, our policy procedures that we have here can definitely a great reference. And these are my references. And thank you very much.